Thank you for kind introduction. The title of my presentation is Phase 3-3B experience with long-acting Cabotegravir and Rilpivirine, efficacy, safety, and biologic outcomes beyond 124 weeks in participant identifying as Asian. I have no disclosure. As you know, Cabotegravir Rilpivirine administered intramuscularly every 2 months is the first and only complete long-acting injectable available in Asia. It is recommended by treatment guidelines for the maintenance of HIV-1 biologic suppression. Cabotegravir Rilpivirine injectable reduced dosing frequencies compared to daily oral antiretrovirals. And Cabotegravir Rilpivirine demonstrated non-inferiority efficacy when dosed every 4 weeks versus daily oral medications. Among participants identifying as Asian, Cabotegravir Rilpivirine demonstrated high efficacy and an acceptable safety profile through week 96 in a post-hoc analysis of the FLAIR and ATLAS-2M clinical trials. This study summarized outcomes for participants identifying as Asian through final visit in FLAIR week 124 and ATLAS-2M more than week 152. Data from participants identifying as Asian naive to Cabotegravir Rilpivirine and randomized to receive Q4 weeks or Q8 week dosing in the FLAIR and ATLAS-2M studies were pooled, and number of subjects for this study was 41 Asian. Endpoint assessed in this post-hoc analysis were proportion of participants with plasma viral load more than 50 copies and less than 50 copies at week 112 and the final visit, and incidence of confirmed biologic failure through final visit, and safety and tolerability and adherence through week 112. This table shows baseline demographics and baseline characteristics of participants. Mean age was 39, and most participants were male patients, and there was only one subject who has BMI more than 30. No participant was reactive to hepatitis B virus. This figure shows biologic response up to week more than 152. At week 112, the snapshot biologic response shows 71 participants had viral load less than 50 copies, and at the final visit, 82% of the participants had viral load less than 50 copies. And up to week more than 152, at week 112, there were 2 participants with low viremia, but those patients' viremia was resuppressed. So at the final visit, there were no patients with non-suppressed viral load. So no participant met confirmed biologic failure criteria through final visit. This table shows the adverse events excluding injection site reaction. All drug-related adverse events were grade 1 or 2. Excluding injection site reactions, drug-related adverse events occurring in more than 5% of participants were pyrexia, myalgia, and chills, fatigue, and so on. Overall, 5% of participants withdrew due to drug-related non-injection site reaction adverse events. This table shows injection site reaction summaries. All injection site reactions were grade 1 or 2. Median duration was 2 days, and most events resolved within 7 days, and 5% of participants, two subjects, withdrew due to injection site reactions. This figure shows overall injection site reaction trend by visit through week 112. The number of participants reporting injection site reactions at each visit decreased over time. This figure shows the adherence to the dosing schedule. Most injection visits, 96%, occurred within the 7 days dosing windows, and 2 injection visits were missed and covered by oral cabotegravir rilpivirine. In conclusion, cabotegravir rilpivirine long-acting injectable demonstrated high efficacy with no confirmed virologic failure and an acceptable safety profile in participants identifying as Asian through the final visit in FLAIR and ATLAS-2M studies. All injection site reactions were grade 1 or 2. Most were short-lived, and a few discontinuations were for injection-related reasons. These data support the use of cabotegravir rilpivirine long-acting injectable as a complete regimen for the maintenance of HIV-1 virologic suppression for people living with HIV who identified as Asian. Yeah. That's it. Thank you very much.
Yeah.